Okay, now we're going to start back up with the cardiovascular programming section of this lecture. So when we think about cardiovascular programming, we're hopefully thinking about things that are going to increase our heart rate. So running, walking, Stairmaster, elliptical, any kind of sports, swimming, etc. But we also need to think about the elements that go into a cardiorespiratory workout. That's what CR stands for. Okay, so obviously you want to have a nice warm up. Then you go into that actual endurance conditioning, and we're going to spend a lot of today talking about that, and then go into a cool down and then a stretch. So here's a nice picture that depicts what happens during one bout of cardiorespiratory training. So on the x-axis, you can see the start of exercise, 10 minutes into exercise, 20 minutes into exercise, 30, 40, 50, and then the stop. And on the y-axis, what you see is heart rate. Okay, so that goes from 60 beats per minute all the way up to 200. And so what you can see is you can see the individual's resting heart rate. And this is on average what happens to individuals, right? You see the resting heart rate is low, and then as you get into your warm-up phase, you start to see that heart rate increase, which is why we say during a warm-up, but the purpose of a warm-up is to increase our heart rate. And it's really truthful because what we want to do is increase that blood flow to those muscle areas. So after we warm up, then we're in this kind of conditioning phase. That's like that 20 to 60 minute mark. Okay, and that's kind of the serious conditioning. That's the harder part, the challenging part. And then what you see is after about minute 60, you start to have that cool down, and that's going to reduce any kind of cardiovascular complications. And this is one of the reasons why when we do any sort of exercise test, we always include an active cool down because we want to make sure that we reduce the likelihood of that individual having a cardiovascular event while we're working with them. And then that last little bit during recovery, you can start to have some stretch. You can see even still the heart rate is coming back down to those pre-exercise levels. So when we think about a warm-up, there's multiple components we need to include. We're warming up because we want to increase blood flow, like I said, to the cardiovascular muscle as well as the skeletal muscle. We want to increase body temperature. We want to decrease the rate of injury to our muscles and joints, as well as lessen the chance of abnormal cardiac rhythms. And then usually most people will say 5 to 10 minutes of low-intensity aerobic activity will be perfectly fine for a warm-up. Now, when we think about actually cardio or programming cardiovascular exercise, there's an acronym I want you all to remember. And we've gone over this before, but it's really important. Okay, frequency, intensity, time, and type. So ACSM typically recommends 3 to 5 days per week for frequency, 40 or 50% as the low mark for intensity, and then all the way up to 85% as the high mark for intensity. And this is either as heart rate reserve or VO2 reserve, and I'm going to go over those in detail later today. Time is going to be about 20 to 60 minutes, and then type, we're going to try to use large muscle groups so that we can really engage and be metabolically active. And really most cardiovascular programming is going to use those large muscle groups. So remember that FIT principle. So let's go ahead and talk about frequency. And we're going to go over each one of these in detail. Frequency is we want to improve cardiovascular fitness, right? So the way that we could do that is look at individuals who are clients who might be sedentary all the way to our clients who are athletes. So individuals who are coming to us and really new to cardiovascular exercise, you want them to be physically active and get cardiovascular exercise about 3 times a week. People who are a little bit more fit than that can maybe be to 4 to 5 times a week, and then athletes are going to be those individuals who are training cardiovascularly 5 to 7 times a week. And then you also have to remember that for patients who are coming in with some serious illnesses, chronic conditions, special populations, it's not uncommon to actually have them go more frequent, so 3, up to even 7 days a week, but longer duration and lower intensity. And that's one way for them to still get that cardiovascular benefit, kind of with lower risk since they're not doing as high of intensity. Now let's look at some of the intensity ranges. In general, we want our clients to be anywhere between 50 and 85% of their VO2 reserve. And again, I'll teach you how to calculate that today. Sedentary is going to be, if you have sedentary clients, you want them to be about 50 to 60%. And again, if you are working with a special population, maybe someone who's very under-conditioned, it's okay to start at 40% of their VO2 reserve. And then if you're working with the average client, they're going to be anywhere between 60 and 75% of their VO2 reserve. And then eventually going up to their higher fit, motivated people, that's going to be 75 to 85% of their VO2 reserve. Now, there's many ways of which you can prescribe aerobic intensity. Heart rate is probably one of the ones you're most commonly used to seeing. And you can do that as heart rate max or heart rate reserve. And heart rate max is the type that you see a lot in our field, but I think actually heart rate reserve is better in many cases, and I want you all to remember that and try to use that when you're out there practicing. And you'll understand that here in a moment. VO2, you can use VO2 to prescribe aerobic intensity, and that could be VO2 max or VO2 reserve. And what you're going to find is that the equation for heart rate max and VO2 max are very similar, but all you do is replace the variable of heart rate with VO2 and vice versa. And same thing, heart rate reserve or percent heart rate reserve and percent VO2 reserve is the exact same equation, but all you do is replace the variable of heart rate with VO2 and vice versa. And then you have perceived exertion, and that's that RPE scale. And we'll spend a real quick time today just discussing that. So now let's look at exercise prescription by heart rate. Okay, so why we know we can do this is because we know there's a strong relationship between heart rate and VO2. Okay, it's a strong positive linear association. And there are two ways that you can use heart rate to prescribe exercise. The first is percent of maximal heart rate, and that is denoted as percent HR max. And essentially all you're doing is you're taking whatever percent you want them to work at, say it's 60%, and you're going to multiply that by whatever their heart rate max is. And that could either be a heart rate max that you've measured, or it could be an estimated heart rate max. So this intensity fraction, for instance, if you were going to do 60% of someone's heart rate max, you'd actually put in there 0.6 and then times their max heart rate. That's pretty simple, and that's the one that you most are used to using. This is the one heart rate reserve that I actually suggest you use, and you'll see here a few examples of why I suggest using that. What you see here is that in order to calculate someone's heart rate reserve, you still need that intensity fraction. So for this case, we could still use that previous example of 0.6. And now what you want to do is multiply that by the difference between their maximum heart rate and their resting heart rate. And once you have those two things multiplied, then you add in your resting heart rate. This is really important because our resting heart rate tells us something about our cardiovascular fitness. The lower our resting heart rate, the more cardiovascular fitness we have, right? With the greater our cardiac output is, or not cardiac output, sorry, our aerobic output is. And so it's important to know that if we have someone's resting heart rate, which is a really easy thing to get from our clients, we can then calculate their estimated heart rate reserve, and that's going to give a better indication to actually the intensity of what they should be actually working at. So again, there's some problems with using that max heart rate method, right? It doesn't include resting heart rate, and resting heart rate is usually a much better indicator of someone's aerobic capacity. And here's an example of an older adult and why this can be an issue. So say you're working with someone who's 70 years old and her heart rate is 90 beats per minute. Well, if you were to use that kind of standard just percent max heart rate method, you would take her max heart rate, which is typically what we do is 220 minus 70 to get her max heart rate as an estimation, and you multiply that by 64. So if we were to get 64% of her max heart rate, what we'd find is that's 96 beats per minute. So 64% of 220 minus her age, which is 70, is 96 beats per minute. But if you do the same calculation, but with the Carbonin formula, which is also known as heart rate reserve, now you're going to incorporate that resting heart rate. So this might be a good time to pause and actually practice this, right? So take 220 minus her age, right? And then plug that into as well as her resting heart rate into that heart rate reserve formula, which again is known as Carbonin formula. And what you're going to find is that it's 96 beats per minute. So what we're seeing is that this can't really be 64% of her max, right? So like at 96 beats per minute, we know that 96 beats per minute is the answer for her max heart rate range. We know that that's not really realistic, right? So if her resting heart rate is 90, how could her 64% of her max be 96, only 6 beats per minute greater, okay? So that's where we can use the heart rate reserve formula. And I'll get into that in just one moment, okay? So right now, what I want you to think through is if we don't know their max heart rate, what are some ways that we can estimate their max heart rate? Many of us are used to that 220 minus your age, and that's a very common thing to do because it's pretty easy to use, but there are certainly other ones that you can use here, and they're important resources to have. I will say on all of your exams and quizzes, I use 220 minus your age because it's the simplest one to use, and I know that you all are using that one. Okay, but I wanted you all to have this resource in the future. And then exercise prescriptions by RPE, and this is rate of perceived exertion, because there are certain clients that you will not be able to use heart rate as an exercise prescription. Okay, this includes people who have certain clinical conditions. We know this from working with LifeFit, right? If they have any sort of cardiac transplant, if they're on beta blockers, if they have a pacemaker, all of those things are meant to help regulate their heart rate, and so will artificially lower or decrease or raise their heart rate. And so that's why we can't use heart rate to really use that for intensity for these individuals, okay? There are certain drugs that elevate heart rates. Pregnancy has an impact on heart rate. And then also sometimes it's really difficult to measure someone's heart rate, okay? So these are all reasons where we wouldn't really want to use heart rate to prescribe exercise intensity. The talk test is another way that you can do this. And a talk test is simply talking to your client and saying, okay, well, your max is going to be when you're completely breathless and you can't get another word out, right? Your resting is you can have a full conversation and no problem. Moderate effort is going to be you being a little bit heavy in your breathing, but you can still say a word or two. So that would be an example of how to utilize talk test for intensity with your client. And then rate of perceived exertion is that 6 to 20 scale or that 0 to 10 or 11 scale. And here's kind of a visual of both. I tend to use a 1 to 10 scale with my clients for RPE because I think it's easier for them to understand, although many clinicians will use the 6 to 20 so that it kind of aligns with heart rate. And so you may not understand that and know that, but how the 6 to 20 scale was originally started was that it's supposed to say that if you add a 0 after all of these numbers, so if you add a 0 after 6, a 0 after 7, a 0 after 8, that then becomes 60, 70, 80, all the way to this 20. If you add a 0 after that, that becomes 200. And it's supposed to correlate with their heart rate. So if someone says they're at a 13, that means that their heart rate is at 130 or should be around 130. Okay, and so we know that that's not always true, but that's kind of how this was started and what it's founded based on. So now let's look at exercise prescription by workload. And now this is when we're going to get into percent VO2. Now, VO2 is something that we can measure in a clinical setting, but sometimes we still want to use VO2 or percent VO2 in our intensity equations, right? So how we're actually prescribing intensity for our clients might be percent VO2, like I discussed earlier. So even if you don't necessarily are able to measure their VO2, you could still prescribe based on VO2. And I'll explain that later today. Okay. The two equations that we use are percent VO2 max and percent VO2 reserve. And again, if you look at these intensity fractions, or if you look at these equations, what you're going to see is that these are exactly the same as the heart rate equations that I just listed, but all you're doing is replacing VO2 with heart rate. So again, VO2 max is just that intensity fraction, so let's use 60% again, so 0.6 multiplied by VO2 max. Okay, VO2 reserve, exactly the same as that previous equation, but now you're replacing VO2 with heart rate. So you have intensity fraction, which could be 0.6. You multiply that by the max heart rate minus the resting heart rate. And then you add in max VO2 minus rest VO2, and then you add in resting VO2. So now you're thinking, well, do I need to measure their resting VO2? That's actually always a given. So what we assume is that for the average individual, someone's resting VO2 is 3.5 milliliters per kilogram per minute. That is going to be something that you all will need to remember. Okay, so remember, someone's resting VO2 is always going to be 3.5 milliliters per kilogram per minute. So let's go ahead and look at how we can prescribe this. We know that intensity fractions for VO2 should go anywhere between 50 and 85%. So that starts on the lower end for sedentary individuals, and it can even go as low as 40% if you need to. I think for average or healthy individuals, this can be up to 60 to 75%. And then those individuals who are highly fit and really motivated, that can be anywhere from 75 to 85%. Okay, the goal, though, is to determine what's appropriate for your client and determine what that appropriate workload is so that they know what their oxygen consumption should be. Now let's talk about the time of your FIT principle. 20 to 30 minutes is usually appropriate to start, and that doesn't include warm-up. And again, this is specifically for cardiovascular training. Rarely do you prescribe cardiovascular training that's longer than 60 minutes because of the increase in risk of injury. However, there are certain clients when they're training for things like a marathon or even a half marathon or a triathlon or something like that, where the amount of time is going to exceed 60 minutes. Okay? We always need to consider our frequency and duration as well as intensity together, because all of those variables go into how challenging this is going to be and then the rate of injury that might happen. Really important that we remember to only change one variable at a time so that we decrease the likelihood of too much overload and injury. So now there's always this question of when you're prescribing aerobic exercise for a client, can you do that in short multiple bouts? And the answer is yes. What most science will show you is that if you can get people at about 10 minutes, that seems to be the minimum amount of time that we can have those cardiovascular benefits for individuals, okay? So 10 minutes is that minimum amount of time. Now, the kind of health coach in me wants to say, if someone only has 5 minutes to give, is that better than sitting? The answer is yes, right? 5 minutes of movement is better than 5 minutes of sitting. But when we think about goals for cardiovascular programming and really wanting to prescribe exercise, 10 minutes is kind of that minimum that we see those cardiovascular benefits. Now let's look at type, okay? What we're really going for is continuous dynamic exercise. Dynamic meaning multiple muscle groups, multiple movement patterns. Again, large muscle groups are always ideal here because they're more metabolically active. And some examples can be anything from a treadmill to Stairmaster to swimming to biking. So there's lots of examples here. Always want to consider safety concerns and the preference of the client. Always thinking about variety because people get bored really easy. And then also thinking about, can I incorporate weights in a cardiovascular programming? And I think the answer is absolutely yes. If you think about any kind of HIIT resistance training workout, that's very cardiovascular, right? So some personal trainers are starting to kind of do 2-in-1s. They're realizing that they only have 45 minutes to an hour with their clients. So how can they get resistance training and aerobic training in at once? And the way they do that is through some sort of kind of HIIT protocol, okay? Or even like circuit training. So now let's go and spend some time in the different types. So some people refer to exercise modalities or cardiovascular exercise modalities as type A through type D. Type A are going to be those things that are very simple to do and every person hopefully can do them. That includes things like walking and cycling. Type B are going to be those ones that are kind of low skill, average fitness level. So most people can kind of jog and do some sort of stepping pattern. Type C are going to be those kind of higher level endurance activities that require a little bit more skill and a little bit more fitness. And this can be things like swimming and cross-country skiing. And then you have type D, and these are people who are engaging in recreational sports. So they're irregular intensity. So if you think about basketball, you sprint, you stop, you pivot, you move, right? Racket sports. So these are very advanced. So basically type A to type D are more hierarchical as you go down. Always a good idea then to start with type A, especially if you're starting with a beginner client. Progress to type B and C, and then potentially if the client wants to, they can move to type D. But not every person wants to do those kind of recreational type sports and movement patterns. So that really depends on your clients. This is just a reminder of stages of progression, right? And we discussed this in an earlier lecture, initial conditioning, usually those first 6 weeks. Then you see improvement in months 4 to 8. And then that maintenance stage is the latter part of a year. And you really kind of want to have clients training for life there, right? Training for the rest of their life. When we think about progression, we always want to think about how we're progressing. And we know that the greatest conditioning effects occur in that first 6 to 8 weeks. So, and this is where our clients get a little bit frustrated because those first few months, they see a lot of improvement. Even in cardiovascular training, right? They see a lot of improvement in those first few months, and then they keep training, and then they're starting to see less and less improvement. And you can see changes of VO2 max of anywhere from 5 to 20%, which is pretty substantial. Okay? And it's really important that that happens because we really think about overload. We think about those principles like duration, intensity, and frequency. So I'm going to pause here, and the next video is going to be on different endurance programming styles, including these 4 styles listed below.